EF20 Online is sponsored by the Climate Council of Greater Kansas City and KKFI 90.1 FM, Kansas City Community Radio. Please welcome our hosts, Alfredo Palacol and Patrick Hampton.
I'm going to switch this over. Hopefully you can all see my screen. My name is Alfredo Palacol. I am the Director of Case Management at Hope Faith, and I have Patrick Hampton as well. He is our grant writer. And today we're going to kind of get folks caught up on the work we're doing at Hope Faith, updates in regards to kind of our response to COVID-19, and then the parallels between sort of climate impact and sort of COVID-19, and sort of the communities who are most vulnerable, and sort of ways we can remedy that and move forward as we as a community, as a whole global village, move forward past COVID-19. Ways we can kind of reset in a way that we can change course and the other things that are affecting kind of our global community in terms of environment and impact. So to begin with, I'd love to be able to start with kind of Hope Faith and a little bit of background about the work that we do, and specifically with those experiencing homelessness in Kansas City. Hope Faith was originally started in 2004 and then moved to our current location, which is 705 Virginia, sort of close to the corner of Admiral and Paseo, in 2011, and fully opened in 2012, with the goal of sort of filling the need in the city, which was a drop-in center for folks who are experiencing homelessness. Up until Hope Faith set up shop in our current location, there really wasn't a single space where folks can go to receive services. So there's amazing agencies, but they were spread out throughout the metro. And so if someone is experiencing homelessness and was wanting to get out of the shelters, and access services, there wasn't a particular place. And so that's the hole that Hope Faith wanted to fill in the safety net, specifically a collaborative day center where folks can go to receive multiple services, including meals, access to essential services, showers, hygiene, things that would help stabilize an individual. And so in doing so, we created a space that was also a place where other agencies could provide services. These included things like medical, vision, dental. We knew that one of the kind of challenges that folks who are experiencing homelessness is accessing all these services. Knowing a great example is having to go to Truman and then having to access a case manager in another part of the city. We want to have all those places in one location. And so with that, we've partnered with most of the major agencies in Kansas City that provide all sorts of services to housing, behavioral health, substance use, and to be able to provide all those wraparound services in one place. On a typical day at Hope Faith, we would see anywhere between 150 to 200 unduplicated individuals coming in for services, where we're providing anywhere between 300 to 400 meals a day. And this was all pre-pandemic COVID-19. And so with sort of the most recent sort of developments, our agency, in sort of partnership with the community and sort of the Greater Kansas City Coalition to End Homelessness, and as well as other agencies such as Veterans Community Project, Restart, really came together to have a COVID-19 response. And so let me kind of swoops, hopefully you guys are seeing that. And so real quick, one housekeeping item that I completely forgot about. If you are kind of looking at your Zoom screen, there's a Q&A section at the bottom. And so if you have questions as we're kind of going through our presentation, feel free to stick them in the in that Q&A section. Myself Patrick will kind of go through those, and hopefully we'll be able to answer some of those questions along the way. And so bear with us as we're new to this whole sort of Zoom kind of presentation thing, and try to provide all the information that that we can to the whole community. So back to our back to COVID-19. So basically on March 12th, 13th, the city and sort of the surrounding communities sort of went into sort of this next phase in terms of the response to the epidemic. You know, as a nation, we've been following this in as early as end of February into March. Specifically at Hope Faith, we started really paying attention to this in the beginning of March, knowing that the particular population that we serve is highly vulnerable in the sense that we have a older population, we have folks who have chronic illnesses, we have folks who have underlying health conditions that we know would be severely impacted with the coronavirus. And so our concern immediately was to have a mounted response to this. And so on March 13th, March 12th, collectively as a community of agencies, we came together and decided on what our next steps would be. And so that's where we knew that we were entering in sort of uncharted territory. Service communities around the nation weren't prepared necessarily, so there wasn't necessarily a predefined game plan as to how do we approach an epidemic, a pandemic specifically in terms of our homeless communities. And so starting on March 13th, March 12th, we really went into hyper sort of planning, collaboration mode. And so one of the outcomes of that was Hope Faith was designated as sort of the crisis center for Kansas City for those experiencing homelessness. So working closely with Veterans Community Project, working closely with Restart, the Coalition, and all sorts of agencies, we became that front line as service providers. Many of the agencies that were providing services suspended their operations in order to protect their particular agencies, their community. But we knew we had to fill that particular need, that it was essential that Hope Faith continued to operate as safely as possible. Because as this epidemic unfolds, we knew that our population, if we were to stop providing the core services that we are providing, they become that much more vulnerable. We have a population that is unhoused or don't have access to adequate shelter and housing. They can't self-quarantine to locations. They don't have the mobility to access hygiene. You know, when folks were sort of hoarding toilet paper and other necessities, we have a whole community out there that didn't have access to that. And so working closely and as safely as possible, we migrated all our operations outdoors. And with that, began working with all sorts of service providers to be able to provide medical, and more recently, being able to provide testing. And so for the last month or so, myself and our direct service staff, working closely with our sort of peers at Veterans Community Project, have been sort of frontline case managers providing services to those experiencing homelessness. So on top of all this, we've been in very much overdrive mode, and the fact that we have such a small team. If you look at the bottom corner of your screen there, where you sort of see 4 individuals and myself taking the picture, for the first 2 weeks, we were the only active case managers for the whole city, which meant dealing with issues around domestic violence, helping people access shelter, providing sort of those core services that would normally happen. Those particular set of services and functions fell on our shoulders, and we've been doing that now for the last month or so.
Alfredo,
yeah.
I want to just interject one housekeeping issue. I think some people are having problems seeing the slideshow.
Oh, okay.
I just want to see if we can get it pulled up for everyone.
Yeah, let me. So let's get that going. Cool. Are we good now?
I think we're good. So, I mean, we've got a question that's come in too. I don't know if you want to take it now or later on in the presentation.
Let me, let's have a chance to have the folks kind of see kind of the slideshow, kind of some of the pics here. But kind of what I was referring to is sort of that bottom left-hand corner there. That's been our sort of case management team. The folks are a small team who've been on sort of the front line providing these key services for the last month in as safe as way as possible. And so that's sort of been our response in order to not drop services and have that continuation while we've been under sort of this epidemic. But yeah, so why don't we field some of those questions?
Sure. So the question is, providing nutrition food for the homeless is a challenge on its own.
Sure.
With climate change and now COVID-19, what is the most challenging thing facing Hope Faith in providing nutritional support? And secondly, how can the community help out in the most efficient and beneficial way during this time?
Right, and that's a wonderful question. So I think what's been amazing about Kansas City is sort of the community here, the community of restaurants, and as their particular situations have worsened over this last month, restaurants, individuals have really stepped up to provide meals and food to us. And so, so to answer that particular question, on a typical day prior to all this, we were serving anywhere between 400 to 500 meals. We're still continuing to do that, but have probably added additional 200 plus meals in the sense that we're providing meals to adjacent agencies. This week, we started providing meals to the KCPD. We also have started to see an influx of new folks kind of entering our system. And so that's really kind of what I also wanted to begin to get into as kind of, there's a lot of parallels between sort of climate impact and sort of the things that are happening on a system-wide level with the pandemic that we're seeing right now. And so as most of us have experienced this last month, a complete shutdown of services and sort of a rearranging of kind of how we look at the world and sort of responding to sort of this new uncharted territory, if you will. This has very much parallels to what we would see should there be a vast climate disaster, environmental disaster. And we're currently have been seeing that. That's been a trend with climate issues for the last couple of decades. Specifically when we're talking about homelessness and sort of the issues around climate impact and sort of the issues around that, we have to look at homelessness as sort of symptomatic of poverty. And so when we look at sort of the last 20 years, 30 years of climate erosion and the impact that it has had in the environment, we see that very directly in sort of the environmental kind of vulnerabilities of those who are poor throughout the world. A great example are coastal communities locally here in the sense of California and Florida, where we're beginning to see things like wildfires, which in that sense, we're seeing sort of more people enter the homeless sort of systems that we have. But if we really take this to kind of the global perspective in terms of the impact that this has on the most vulnerable, we know that, for example, agrarian societies, where communities who are very dependent on the climate for their means of living, we see that. We see that those effects in terms of harvest and not being able to predict and not having quite the yield that we've had. If we look at this last year in terms of the amount of flooding and water that have saturated the fields here in the Midwest, how that's impacted our agricultural system. So we see when we're talking about sort of the impact of, again, on climate change, the environment, on our homeless communities, we really have to look at it in terms of all the vulnerable communities throughout the world and how they're interconnected. And so one of the let me talk about back to climate impact. Most oftentimes we want to be immediate in terms of how changes in the environment are impacting folks. In California, for example, the increased wildfires. Australia is a great example. We have rising sort of sea levels. Those are very immediate sort of changes to the environment that impact people immediately. We see that the hurricane seasons have changed. Hurricane Sandy down on the East Coast, and then as well as sort of what happened in New Orleans. We see those very immediate emergency responses to changes in the climate. But what I wanted to kind of reflect on is sort of the broader sort of impact that the climate has to the overall systems. And more specifically, sort of the relationship that we're seeing with COVID-19 in terms of the impact. We know that right now, if we don't do anything in terms of mitigating some of the climate risks that are impending upon us as a global community, we're going to see some vast changes in our systems. And so if we look at and kind of examine sort of our current COVID-19 epidemic situations, we really see and can play through what that would look like if we begin to have climate failures in other parts of the world. We see that specifically here, a growing kind of issues around supply chain. If we can sort of look at what was to happen if where our agricultural base, which a lot of it comes from South America, Mexico, because of different trade kind of agreements we have, if that were to be impacted and how that changes, even now with COVID-19, we're seeing seeing what that would play out more immensely. But also the big kind of immediate changes to that is what we're seeing is the economic impact. One of the big concerns that obviously we're all concerned about right now is the unprecedented unemployment. And as homeless service providers, one of the big things we're trying to mitigate is the fact that we're having a whole new set of folks entering our system, and are we prepared for that? And so those are things that, as we're going through this pandemic, that should help give us some clarity of what that would look like. We have that opportunity now to engage beyond sort of this pandemic, what can be done to mitigate that. So taking that specifically back to our homeless community here locally, one of the things that is when we think about climate change and sort of the economic impact, when we have sort of those catastrophes, we have more people entering the system. Like I said, prior to the pandemic, one of the concerns we were already dealing with is the fact that we're providing services from anywhere between 150 to 200 unduplicated individuals every day. And so now what we're going to be, our big concern is all sort of the new faces that we're seeing. Just in this last month, in terms of direct service, I'm seeing a bunch of new families who are struggling. I'm seeing sort of folks, as other services have shut down, we've had folks who might have been receiving services at the library, for example, come to Hope Faith. And so we see that I think the parallels in sort of the pandemic in terms of what the climate impact would be as things are compounded. And that really talks through to a lot of what I'm hoping people will begin to look at and think in terms of kind of, as we're all sort of hopefully quarantined and self-isolating, that we kind of look at sort of COVID-19, we replace COVID-19 with the word climate disaster, and kind of think about the situation that we're currently in, and hopefully begin to mitigate and think through kind of what are sort of the ways we can kind of adjust sort of our systems and processes, because we're in that time now where we can be very visceral and see what's going on if we don't have action. So as we begin to move out of lockdown, and as we begin to suppress the spread of COVID-19 in the next months and the years to come, this gives us an opportunity to sort of, again, reflect. We're at a place where we're if a lot of folks have been following this online, is we're at a place where we've had a great pause. How do we kind of think about all the communities who are impacted by the coronavirus, but then how do we also be forward thinking in terms of other issues that might be coming down related to climate change, environmental disasters that if we are truly kind of prepared, we can expect for those things to happen. But how do we create systems now that can mitigate that? So, so as we kind of look through kind of what is next, that's what we're also trying to do as a community. One of the things that COVID-19 has really accelerated is the ability for us to collaborate. One of the great, I think, silver linings to the current pandemic is that a lot of our agencies within the service providers who have been working so closely together previously are now much more intertwined in terms of providing services to those experiencing homelessness, but more importantly, are thinking through how do we prevent more folks from entering the homeless systems? How do we prevent that surge, which we're expecting, especially with the downturn in the economy? How do we get ahead of that? How do we provide sort of those core services to prevent that? And so that's where I am looking to folks to kind of to take away from this time, is to kind of think about COVID-19 in terms of the broader impact it might have, especially with those of us who are working in the social services that impact homelessness. How do we also look at that to provide this opportunity to really think through those potentials? Here in Kansas City specifically, we're one of the things that our particular community faces is in terms of climate and environmental changes is obviously direct weather. We go from hot to cold, cold to hot. That creates all sorts of challenges for the folks that we serve here. But then we're also part of a larger kind of community of service providers. So when we're thinking about California or Florida, what are sort of those different things that will impact, as far as climate, that will impact the communities they serve. So, so with that, let's see, it's 2:25. I'd like to kind of answer any questions that are beginning to pop up here. So let's kind of answer this one. So the question we have here is, we're learning that a vegetarian to vegan diet is beneficial to the environment. Many areas are going to meatless days to reduce the amount of meat in the diet. Does HF work towards meat reduction in meal plans at your center? So, so one of the challenges that we particularly face is that a lot of our food is donated. And so we always try to have a vegetarian option. And that kind of leads us to kind of one of the challenges with feeding folks is the fact that, yes, there's plenty of food, but how do we create nutritious meals for folks? So one of the great things about Kansas City is there's plenty of food available, but how do we create a more sort of healthy kind of set of meals for our folks? And so that's something we've been considering. One of our biggest projects that we've been really kind of hoping to take to this next level this year is our Hope Grows program. One of the things that we do and try to create a more holistic environment at Hope Faith is we maintain community gardens. Typically, we had an offsite garden as well as a garden that was right off of our main building, where we would grow close to 9,000 pounds of produce, which we would then incorporate that into our meals. And so we know that creating healthy habits for our community, being able to provide healthier meals is going to impact the community as a whole. And so one of the things that we're moving towards while this pandemic is growing is we're actually building out a new greenhouse. And this way we would be able to provide fresh produce year round. And so hopefully that will begin to kind of, as kind of that question is regards to sort of providing less meat, we can begin to provide more vegetarian focused meals as well. That's locally produced, literally right next to our building. And so, so that's one thing we're considering, both for the health of our guests and the people that we serve, but then also part of that bigger picture as well.
That's great. And I know we have another question about social distancing and how we're doing that and maintaining CDC guidelines with the number of guests we're having coming in every day and all the services we're providing.
Absolutely. And so, so we've really, from I want to say early March, the CDC and the World Health Organization has really informed our approach in terms of how we handle our daily operations. And so originally we had started off from limiting the number of guests in our building. Like I said, we were typically seeing upwards of 230 folks every day, which obviously from a social distancing standpoint in terms of, and as well as spread, that was a big, that was an immediate big challenge. And so one of the first things that we did was starting that first, let's see, March 16th or 17th, we started limiting the number of guests in our building to 50 individuals at any given time. But then within really quickly, we realized that that wasn't going to be effective in terms of the number of folks that we were seeing. And so we immediately moved all our operations outdoors. And so working closely with the city has been a great partner. We're able to close off the street right next to us, which is Virginia Avenue. And so what we've done is created an outdoor village. And so hopefully folks have maybe seen some of the media. We've been able to create an outdoor village, which creates, number one, we have the open environment. And then we'll also have a very stringent process of both screening individuals who are coming through, doing temperature checks, asking for sort of signs of, asking the individuals to share with us if they're not feeling well, and then providing masks for everyone as folks are going through. I think one of the things that we did very early on was provide information to the community. And I think that goes true with environment and the climate issues as well, is that on Saturday, the 14th, collectively as a community, we began putting out information about what COVID-19 is. How do you begin, how do you protect yourself? What is the disease about? And the importance of social distancing. And critical to that was the fact that, yes, we were providing that information, but the fact that our community was also beginning to change their behaviors. And I think that relates very much true to also to climate issues as well, is that if we can get the information out to folks, that hopefully they'll begin to change their behaviors as well. So it was a very much holistic approach to kind of maintaining social distancing, making sure that we have the right protocols in place, and really being very, one of the things that we do, and it's vital to Hope Faith, is our relationships with every individual in the community that comes through. And so it's a partnership. And so, our community has responded greatly in the fact that they've shared that information and those practices are being in place. And so that's, I think, how we've been able to mitigate and minimize, hopefully, the spread of coronavirus. But you know, it's an ongoing concern. And so we don't look to let up. We see ourselves kind of maintaining this style of operation into the end of the year. What's great is now we have our medical partners, Heart to Heart, SWOPE. We have our new set of medical volunteers through our Hope Health initiative. And so we are prepared sort of for those medical eventualities that will happen, in the fact that we expect sort of hope. We hope it doesn't happen, but we're prepared for a potential surge in our community come when we would typically have the flu and sick season in November and December. So as the coronavirus has hit community spread, we want to be prepared for that. And so we're doing the best that we can in terms of always being updated on information and really reacting and acting as proactively as we can. So let's see, what else do we got? And then, so yeah, so let me pull up anymore. So with that, I just want to see if there's any more questions, put it out there that you might have about sort of what we're doing in terms of COVID-19 or sort of maybe our long-term planning. If you're interested in getting involved, you can visit our website at hopefaith.org. There's volunteer opportunities. One of the big things that we need right now is assistance in helping prepare meals. We have a set of volunteer opportunities where there's minimal amount of guest contact. And so being behind the scenes and helping us prepare and distribute the meals behind the scenes would be a great opportunity for folks who want to get involved. And then as the weather begins to hopefully warm up, hopefully we'll have some spring opportunities. We do have some opportunities with our community garden. Like I said, we're building an outdoor, or rebuilding a new greenhouse, but we know we'll have some planting and some being able to transfer one of our existing community gardens, some of the things there to our new location would be a great opportunity for folks to get involved.
It does look like we have a couple of other questions. So first one would be, are there any services that are on hold as a result of COVID?
Sure. So right now we've been able to bring most of our critical services back online to the community. So that includes case management, helping folks still access housing, which is sort of something that's a little bit out of our control, in the sense that that also relates to sort of the availability of landlords to provide some housing options, but we're still working on that. One of the things we're trying to get back online, and this is where we have that need for kind of clothing donations, is beginning to provide laundry service for folks. There are some issues around that in terms of ensuring that we have the right hygiene and protection for folks who will be doing laundry. And so that's kind of one of the services that's on hold, but we're working to figure out how to get around that or provide clean laundry to folks. But so in the meantime, we're trying to provide donated clothing for those who need items. Showers are still going. Mail service, which is one of our critical services that we provide. We typically we have a mailbox system where we provide mailboxes for up to 450 individuals, but we're providing mail for up to 600 plus right now. Because a lot of folks, if they don't have access to a mailing address, they're effectively locked out of the system. And so that's one of the core services that we're continuing to provide. And then we'll continue to provide also opportunities to connect with behavioral health service providers through telehealth and telemedicine, and making that accessible. So for the most part, the majority of our services are still up and running. They might be pared down a little bit, but all our critical services are up and running for the community.
That's great. So a lot still going on there. And then moving forward to the next question, we had someone ask about the process if one of our guests shows or exhibits symptoms consistent with COVID.
Sure. So again, over this last couple of weeks, we've been able to partner with Heart to Heart as well as Swope, and then we've had a whole set of medical volunteers come through. And so at our particular resource village, we have three medical tents, if you will, actually 2 medical tents, as well as our sort of extended medical area where we have medical units. And so we really ask, and this is where it's really important to have those relationships and partnerships with the community, is that if a guest comes to us and is self-identifying that he or she might have symptoms, what happens next is that individual is sort of sequestered, and we give that individual a mask. And then we have one of our medical professionals come through and then do a follow-up check as far as fever, high temperature, really examine that individual. And so we fortunately have had no one come to our resource center, our resource village, who has gone on to test positive. And so, that's something that we have all been really thankful for, that so far in the community, as far as those experiencing homelessness, there hasn't been a lot of cases that have tested positive. The challenge with our particular community is that folks who are out in the streets or experiencing homelessness, this is the time that they would also have typical ailments around seasonal ailments. And then we have folks who have substance use disorders and might be in withdrawal, and they might have high temperatures and fever as well. And so it can be challenging, but we do have medical staff available on site, and so we can screen for those individuals. And then if those individuals, again, do exhibit all the signs, high temperature, cough, we do have a referral process. So right next to our resource village, the city has secured motel space, so very close, literally maybe half a block. We can have a referral process for as that individual is potentially getting tested, they can be in a isolation space while they're waiting. So we have had individuals who have been referred to the motel awaiting their testing, but so far no one has tested positive for COVID-19. So again, we're really thankful for the fact that we have set up all the preparations and are ready for the eventuality that someone will test positive, but we're really grateful for the moment that no one has. So, is there any more questions, Patrick?
No, I don't think so. I was going to ask, though, if you could touch a little bit on the mental health aspect and some of the challenges that the population we serve faces, and how that could be magnified by the effects of climate change, or in this case, the pandemic.
Sure. The behavioral health is one of those, the challenge behind behavioral health is it's very much an in-person intervention. And so the fact that oftentimes at the moment we have folks who are in behavioral health crisis, and we have to proceed with a lot of caution in terms of our own protection and sort of ensuring that as providers we're protected, but that we can also get them to the right service provider in terms of a qualified mental health professional. And so I think the great thing about the time that we live in is the ability and the technology that we have right now. Great example is the fact that we're video conferencing. We're able to connect. In the last weeks that we've had individuals who have behavioral health issues, we've been able to connect via phone. And so I think phone and then video conference, and we're going to start opportunities around providing behavioral health via teleconference and video conference. I think what compounds sort of the issue is sort of with an epidemic or a crisis such as climate change is the fear. And it exacerbates sort of the sense that individuals might be going through with sort of the kind of larger kind of issues that are happening. It really compounds that fear. It for folks, especially the individuals that we've come across, you know, it's created a whole set of reasons to be fearful. And so mitigating that fear is, I think, kind of one of the challenges that we face around an epidemic as well as any sort of climate crisis. Okay.
Looks like we just have one more question about if homeless people are staying overnight at Hope Faith or if they're going elsewhere. And then we have just a couple of minutes left. So I don't know if you can answer that and wrap up for us real quickly.
Yeah, absolutely. So, question. So unfortunately, we are not a shelter. And so we've had individuals who have come through. So we don't have anyone who can stay at Hope Faith, but we've been able to work with local shelters that are still remaining open and taking clients in, such as City U. So we've been able to kind of work with their staff to get individuals referred to those locations. And then I think there's one question about the last question during the heat wave, do you see a change of homeless guests, increase in heat related issues? So yeah, so that's always environmental issues around heat, cold, that always creates all sorts of issues. We've had heat stroke. When we've had these last few winters, when we've had some extreme cold, we've had increased issues around frostbite. So anytime we have had sort of those extreme temperatures, it affects our homeless communities who are unsheltered and staying outdoors. And so, so I know we only have a couple more minutes left. Again, thank you guys for being here. If you have any additional questions, feel free to email myself. My name is Alfredo. And you can email me at alfredo@hopefaith.org, or just visit us at hopefaith.org on the website, or check out one of our social media platforms and connect with us that way. But again, thank you guys for spending some time with us, and we hope that we can connect with you more and figure out ways we can kind of mitigate the different crises that our community is facing, that we can do that as a community because our strength is coming together and solving it as one. So again, thank you guys. Hope you guys stay healthy and well. And we look forward to connecting with all of you after all this pandemic is over. So thank you.